The nursing process is a process that has 5 steps. For our purposes, we are not covering human needs statements. Anytime a nurse comes on shift, we do the nursing process without even knowing we're doing it. For example, we always have to assess our patient. We have to assess the patient before we identify what's going on. Once we get our assessment information, then we can collectively take our objective and subjective data to be able to make a diagnosis and then plan our interventions. Once we have our interventions, we will implement them. After we implement our interventions, we will evaluate. Then we evaluate to see, did what we do actually work? If it does, that's great. And if it doesn't, well, then we need to reevaluate. Let's break it down each further through each step. The first step of the nursing process is assessment. This is something not only applicable in nursing, but really in your whole life. And if you take that approach, it will really help you troubleshooting situations and making sure that you're going through the correct process. Here's a scenario applicable outside of nursing. Let's say I'm getting ready to hang Christmas lights up. What should I do before I start hanging my lights up? Well, I should probably plug them in. I'm assessing each light to make sure they're working because I don't want to hang all of my lights and then realize, well, one of them doesn't work and I don't know which one, so now I have to take them down and start over. Here's another example. Let's say I'm taking a class and something doesn't make sense to me. I'm not going to immediately reach out to the instructor because I probably overlooked something. And as a lifelong learner, I recently just finished my doctoral program in 2020, so I can attest to having to utilize this because I was a student just like you are not that long ago. So for example, I'm going to go back into the syllabus and review that because I probably overlooked some of the instructions. And then I go back and review and find out, well, there's a rubric for the assignment. So by reviewing the rubric, I've answered my own question, and now I don't need to ask the instructor so that they think I'm not reading the directions. And trust me, it only took me doing that a few times to learn that really quickly and really feel like that applied to all areas of my life, which has been incredibly helpful. So let's bring it back to nursing. When we look at assessment, it's a collection of data from a full assessment of our patient. It's not just something subjective, it's also something objective. If you're not sure what those two mean, let's break that down because it's really important that you understand the difference. When we talk about something subjective, that's something that is described by the patient. So let's say they complain of having a really bad stomach ache and they feel like they have a fever. That would be subjective. It's the patient's experience. Then we have objective. Those are measured by somebody else based on our assessment data, and they're considered signs. So let's say I do labs. I draw labs and I see, well, your white blood cells are elevated, and I take your temperature, and your vital signs show you have a fever of 101.2. That is objective data. So we need to take our subjective and objective data to collectively identify through assessment what our problem is. Every patient should have a thorough assessment, whether you're talking about a patient that's in the acute care setting, such as the hospital, or outpatient setting or in the community. Once we've collected all of our data, then we can synthesize and identify what exactly our problem is. I can't start planning and identifying an outcome for the patient until I know exactly what the problem is. I might have a general idea when a patient is admitted. Let's say they get admitted and I see an admission note saying GI upset or abdominal pain. That's very, very ambiguous. I need to do my assessment to pull the information together. I can't start doing interventions until I've identified what my exact problem is. And that leads us to planning. Now that we have our objective and subjective data and we fully assessed, we can now identify what our problem is. We need to make sure that when we're planning and identifying what our goal is, that we use a SMART goal. A SMART goal is anything that's specific, measurable, achievable, realistic, and has a time frame. You'll also hear that word interchangeably with outcomes and goals. Those are the same things. Outcomes should also be very specific to each individual patient. We can't make the same goal for every patient that comes in with a stroke because every patient's stroke is going to be a little bit different. So we have to make sure that we tailor care to each individual patient. So one example, if I have a patient that comes in with severe abdominal pain, they've already received pain medication and it's not working, so we need to try other types of pain medication. That's not realistic to say that by the end of my shift, the patient is not going to have any pain at all. I need to take a goal into account that is specific to this patient, that I can measure, and that it's realistic. So if right now my patient is complaining of 10 out of 10 pain, a realistic goal would be in 4 hours, the patient will have a pain level 5 out of 10 and will appear more comfortable. Another tip is when you're writing goals, you never want to say that something is going to be normal. For example, if you have a patient that comes in and their heart rate's in the 30s, that's not realistic to say by the end of that shift, their heart rate's going to be normal. What is normal? Yes, we know that a normal heart rate is 60 to 100, but is that normal for that patient? You need to take into account your patient's baseline. For example, my resting heart rate is 42. That is not going to be the case for another person. Their resting heart rate might be 65. So you always want to take the patient's trends into account. And again, remember, these are very specific and individualized to every patient. So never give a goal of something to be normal. You always want to make it specific. So their heart rate will be back to their baseline of 50 to 60 by the end of the shift. And now we move on to implementation. With implementation, this is the process where we implement our interventions based upon what goals that we've set. So if we go off the previous example of the patient having pain, we've identified that our goal is going to be to go from a score from 10 to 5 by the end of our shift. So now, what interventions are we going to do to help the patient achieve that goal? Now remember, nursing, we do not work in silos. That means we are collaborative. So we're going to be working with the interdisciplinary team to help make sure that we can meet these goals. Now, what members of the interdisciplinary team are involved all depends on what the problem is. So if my patient is having problems with pain, we're going to be collaborating with the internal medicine doctor. We're probably going to be collaborating with the pharmacist. We're going to be possibly collaborating with a pain management provider. So we always need to think of the other people that will be stakeholders in helping us to achieve those goals. For our patient that's managing pain, some examples of interventions. Implement non-pharmacologic interventions to help alleviate pain, either with ice packs or warm therapy, repositioning, music, and guided imagery. And that's just one example. Under the umbrella of implementation or interventions are the rights of medication administration. You are going to see a variation of how many rights there are. There can be 5 plus 5, 6, 7, 8, and now 9. It just depends on which textbook or resource you're reading or which facility that you're employed at. As long as you understand the general principles, you do not have to go by a set number as long as you understand the general process. Please check out the other video focusing on the rights of medication administration. We've made it to our last step of the nursing process, evaluation. Evaluation is always going to come after our implementation of our interventions. So for our previous patient, we discussed where we were implementing non-pharmacologic interventions for pain. Now we're going to evaluate and see, were the non-pharmacologic interventions that we implemented effective? If by the end of our time frame we set, so let's say by the end of the shift, it was effective, then great. If our patient's pain is now at a 5, we've met our goal. Now we have to identify if there are any other problems, and we're going to restart the entire process all over again. However, if our patient is still having pain and the interventions that we've implemented have not been effective, we reevaluate. That means we need to change our interventions and reshift our focus. I now need to create new interventions to hopefully alleviate that patient's pain, and maybe instead of a 10 to a 5, we need to tailor that a little bit, and let's go maybe from a 10 to a 7. Without reevaluating our goals, we can't move forward in the nursing process. Please also know you might have multiple goals that you have to evaluate. If your patient is admitted for a stroke and then they end up aspirating and then they end up needing surgery, every current problem that that patient is facing and you're managing, you need to have a goal for each problem, which means you need to have interventions for each problem, and you have to evaluate each intervention based on each problem. So for some patients, there can be quite a lot going on. Can you address every single problem during your shift? Unfortunately not. It's not realistic. So you have to triage and identify which one is most important, because we're looking at which could be most detrimental to the patient. That's how we triage whether we address, do we address the stroke first? Do we address the aspiration? Or do we address the surgical needs? You're always going to think of CAB, circulation, airway, breathing. Airway is always going to take priority. Your circulation is very important. Without that, we wouldn't be alive. So then you're going to take things that are maybe not as time sensitive and triage those to the bottom of the list. And that is evaluation.